Chronic myeloid leukemia, or CML, is a type of cancer that affects the bone marrow and blood. It is characterized by the excessive growth of abnormal white blood cells. CML primarily affects adults but can also occur in children, though it is rare. It is one of the few cancers that have seen significant advances in treatment, leading to better survival rates. CML is caused by a genetic mutation known as the Philadelphia chromosome, or PH chromosome. This mutation occurs when parts of chromosome 9 and chromosome 22 swap places, forming an abnormal BCR-ABL fusion gene. This gene produces an overactive tyrosine kinase enzyme that promotes uncontrolled cell division, leading to leukemia. Risk factors: age. CML is more common in older adults, with the average age of diagnosis being 64. Gender: it is slightly more common in males than females. Radiation exposure: high-dose radiation exposure, such as from nuclear accidents or radiation therapy, may increase the risk, though this is rare. Genetic factors: unlike other cancers, CML is not inherited but occurs due to a spontaneous mutation. CML has three phases: chronic, accelerated, and blast phase, each with different symptoms. Chronic phase: early-stage fatigue, unexplained weight loss, night sweats, fever, enlarged spleen causing a feeling of fullness, mild anemia. Most patients in this phase have no symptoms, and the disease is often diagnosed during routine blood tests. Accelerated phase: increased white blood cell count, worsening fatigue and weakness, increased spleen size, more frequent infections, bleeding and bruising more easily. Blast crisis phase: advanced stage, severe anemia, bone pain, high fever, severe infections, increased risk of bleeding. The disease becomes aggressive and resembles acute leukemia. Diagnosis of CML. Blood tests play a crucial role. A complete blood count, or CBC, shows an abnormally high white blood cell count. A peripheral blood smear detects immature white blood cells in the bloodstream. For a more detailed analysis, a bone marrow biopsy is performed, where a small sample of bone marrow is extracted to examine abnormal cell growth. Genetic tests are also essential. Fluorescence in situ hybridization, or FISH, detects the Philadelphia chromosome. And polymerase chain reaction, or PCR, identifies the BCR-ABL fusion gene, confirming the diagnosis of CML. Treatment options for CML have significantly advanced. Tyrosine kinase inhibitors, or TKIs, are the first-line treatment. TKIs block the BCR-ABL enzyme, preventing cancer cell growth. These drugs have revolutionized CML treatment, making it a manageable chronic disease. Imatinib, also known as Gleevec, was the first TKI approved and is highly effective. Dasatinib, or Sprycel, is used for patients resistant to imatinib. Nilotinib, known as Tasigna, is more potent than imatinib and is used for resistant cases. Bosutinib, Bosulif, and Ponatinib Iclusig are used for advanced cases or patients with specific mutations. Most patients respond well to TKIs and achieve major molecular remission, or MMR, meaning cancer is controlled. Chemotherapy is used in patients who develop resistance to TKIs or those in the blast crisis phase. Bone marrow transplant or stem cell transplantation is considered for younger patients with aggressive CML. It's high risk but offers a potential cure. Interferon therapy was previously used before TKIs, but is still an option for pregnant patients or those who cannot tolerate TKIs. Prognosis and life expectancy have drastically improved. Before TKIs, CML had a poor prognosis, with most patients surviving only 3 to 5 years. Now with TKIs, 90% of patients survive at least 10 years, and many live normal lifespans. Regular monitoring with PCR tests ensures effective treatment. Chronic myeloid leukemia has transitioned from a fatal disease to a manageable condition thanks to medical advancements, particularly tyrosine kinase inhibitors. Early diagnosis, continuous monitoring, and appropriate treatment ensure a good quality of life for CML patients. Would you like more information on a specific area, such as treatment side effects or ongoing research?